Doctors of Reddit, what was your dumbest I am embarrassment patient experience? Not a doctor but I'm a medical technologist. There are plenty of I am embarrassment moments but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a band-aid on it. Told her to collect a urine sample for testing. Test came back strongly positive. 4+ reading for blood. She complained to the doctor that there is no way she has blood in her urine, and that the blood from her finger stick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+. Came back a week later, still at 4+. The look on her face when I told her sorry, mom, your result is still positive was priceless. Okay, but for real, please stop sneaking blood into people's urine for your sick big pharma money grabs. Had a pregnant woman whose ultrasound showed the baby had hyperplastic left heart syndrome, half a heart, 100% fatal without surgery, who stopped seeing her OB so she could have the baby in the forest and bathe his breast milk to cure him. SMDH. Med student here. On my pediatrics rotation, a mother refused vaccines for her kiddo after educating herself. When prompted as to what she was using as her source, she replied, "My own brain." Lovely. Maternal instinct is a popular anti-vax reasoning now. Terrifying on two levels. One, that people would actually consider themselves a better source of information than decades of research and results. And two, that they honestly don't realize how easily they are influenced by outside sources and really think their decision came from their own reasoning independently. Paramedic here. Transported a guy who was adamant about only using homeopathic medicine, natural healthy living, etc. and refusing meds interventions x-rays on this basis. He also smoked a pack a day. The ED doc called him on this nonsense with something along the lines of, "You smoke so you're not at homeopathic. You're getting a chest x-ray." I had a 350 pounds patient, late 30s, brought in by his sweet old mother because she was concerned about his recent sweats and shakes. Tell me about his high IQ of over 140. I just nodded and ordered a blood panel. When I got back in the room with the results, he was trying to tell me how he knows more than me about everything to do with medicine. I told him I was diagnosing him with new onset diabetes. He couldn't tell me anything about the pathophysiology of diabetes. Then I asked him which IQ test he took and how old he was when he took it. He said it was an online test a few years ago, like on Facebook. He didn't know what a Stanford Binet test was. Had a patient with a HbA1c of 13 who refused all diabetic medications because he believed that he could control his liver's production of glucose with his mind. He believed himself to be very fit and active and felt that with his mental control he was a better athlete than most other people because he could ramp up his glucose production when he needed to. He was in the hospital for a diabetic foot ulcer that required a transmetatarsal amputation. A male patient injected kitchen oil into his own cheeks because he saw a plastic surgery TV show where a surgeon injected something similar to a model. Then he was amazed that the bumps of the oil didn't go away and were turning red and painful. Anytime someone refuses to vaccinate their kids, here's just a small sample of some of the reasons I've been given. 1. Causes autism. 2. Made from aborted babies. 3. Big pharmacy scam. 4. Unnatural. 5. My kid cried when you gave him his vaccines last time. 6. I never got these diseases as a kid, so my kid doesn't need the vaccine. Seriously, frick you people. I feel sorry for your kids. Also, don't forget I've done my research followed by a strong smell of smoke that emanates from them because cigarette smoke isn't dangerous to kids. I've seen that more times than I'd like to admit. Was treating cavities on a very nervous 4-year-old. Had finally gotten into a cooperative groove when genius mother looked up from her phone and noticed that I was drilling teeth. She was in the room the whole time. I had reviewed treatment with her. She knew we were fixing cavities. Proceeds to curse me out under her breath saying you're drilling holes in her teeth. This is freaking ridiculous. You people are scammers making holes in people's teeth. I kept my calm and said, "Mom, if you have questions I will be happy to answer after I'm finished." I'm shaking with rage at this point because she was 20 minutes late to her appointment and I'm bending over backwards to make sure her kid has a good visit and doesn't end up scared of the dentist. Appointment is over. Kid jumps down, high fives and gives me a big hug, and I turn to mom and ask her how exactly she thought cavities were fixed. She said, "You don't drill. My mother is a dental assistant." I then proceeded to explain in excruciating detail the scientific process of how we remove decay. She said that's not true. I then told her that she can go ask her mom, ask Google, or go to dental school if she wants to know more, but I won't be treating her child anymore. Freaking nutbag. A while back I helped open an urgent care for the first 2 years. When we first opened the doors, one of our first customers was an 85-year-old adorable Asian lady who was really hard to understand but talked a lot. Anyway, this lady comes in for the first time complaining of a stomach pain, which we attempted to diagnose her with something, but nothing added up for about 30 minutes to an hour of her talking until she finally told us she just felt better. Okay. So we don't really mind it until next week around the same time she shows up again with the same problem. And guess what the solution was? About 45 minutes of listening to what she ate for dinner the last few nights. I think we eventually figured out corn was messing with her, but this never deterred her from coming in more. This eventually became a once a week occurrence, then a once everyday thing, until we finally started becoming a busy urgent care and we couldn't really fit her inside our schedule. I guess it wasn't really an I am Verismith experience, but I swear this lady actually came in every day thinking she was on the verge of death, until we had convinced her she's fine. In case you're wondering, I'm almost certain she's well over 90 now and still going. Another possibility is that she's faking and just wants someone to talk to. Anytime a patient comes in who is deathly ill and clearly needs antibiotic, cholesterol, blood pressure, etc. meds to get better that tell me I'm not taking the medicine. I know you just prescribe those because the drug companies pay you. Yes, sir lady. All of these drug companies are giving me dollar bills y'all to put you on an antibiotic, cholesterol, blood pressure medicine, etc. Right. A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. This one happened to my ex-father-in-law, and it's funny, but it's not. He was a surgeon, very gentle, soft-spoken guy, and came out to tell them the biopsy results. To which they responded, "Praise Jesus, it's malignant." He had to explain that malignant meant bad. Honestly, that's freaking hilarious. Not for the patient. I'm still just a medical student, but our hospital sees a lot of poor and poorly educated patients since we're a big tertiary hospital in a developing country. Worst I've seen so far are the old ladies who everyone in the family turns to for health advice, their only qualification being seniority. They usually have a bunch of superstitions that end up contributing to the patient's condition in the first place. I once saw a neonate brought to the ER for a really bad oral infection, and the mother clearly hadn't taken a bath since the delivery. It's a common superstition here that mothers shouldn't take a bath a week or so postpartum, so we figured that's the source of the infection. While we're assessing the patient, the doting grandmother in the background decides she has to comment on everything we're doing. Remember, she's probably the one who advised her daughter not to take a bath. I just had to shut her down because A, it was late and people were running out of patients in our understaffed, under-equipped ER. B, they're more worried that pulse oximetry is hurting the baby's tiny whittle toes when there's freaking pus leaking out of the baby's very inflamed salivary glands. I mean, I get that infections like these are a disease of poverty, that their poor education is just indicative of a wider systemic problem that Philippine society fails to address time and again, but by golly does it get annoying. I told a patient's mother that his heart rate sped up in response to pain as a physiologic response. She exploded at me and got very confrontational. Turns out she thought I was saying it was psychological or all in his head. TL. DR. Don't use big words. No, he didn't have a water allergy. That's impossible. He had vomited one time after drinking a lot of water and thought he was allergic to it. Lady walks into the office. I start coughing. The smell of cigarette smoke is so strong on her. Her dry leathery skin cracks while she talks from the years of sun abuse. She tells me, I've stopped using sunscreen because I researched that it causes cancer. Poor old man with an unresectable brain tumor, glioblastoma, was in the ICU after surgery to debulk the tumor. His family included a pediatrician and a cath lab technician. The pediatrician daughter kept trying to get us to give the patient some homeopathic BS medicine that she brought with her because I work at Harvard and we use it all the time there. I'm surprised you don't have it here. I seriously doubted she was truthful about where she worked, and I 100% guarantee that if she worked at any reputable practice they were not treating kids with whatever crock homeopathic BS she was pushing on us. Unless I actually saw her credentials, I doubt her medical credentials. I have had a few family members try to pass along their internet medical degree as an education. Optometrist here. Had a 38-year-old female patient coming in for a routine eye exam. Asked her all the usual background health questions. Saw she had checked off migraines x 20 years on her health history. Whenever anybody mentions they have headaches I always ask for more details. She said she's had migraines every day since high school. I was a bit confused. I said every day and she said yep. I asked further about her diagnosis of these and she said she's just seen regular family practice doctors and even a neurologist. I asked her to describe the headaches in detail. How long they are, where on the head, what time of day, etc. She got irritated with me and said, aren't we supposed to be doing a simple eye exam? These headaches don't have anything to do with my eyes. They are migraines. At that point I stopped asking questions and silently hid my anger with her and just did the eye exam. Near the end of the exam I noticed her optic nerves were swollen. I explained that swollen optic nerves require urgent referral for imaging of the brain. CT, MRI need to be done first and other testing if there is nothing found. They came back clean. I ordered a lumbar puncture after that and her cerebrospinal fluid pressure came back 3x higher than normal. She was put on a medicine to bring it back to normal and her unquestionable diagnosis of migraines that she had every day for 20 years were instantly cured. Sadly, it's possible she was told that by her doctor. I have migraines and my doctor couldn't give less of a crap. Well, they run in your family. It's just genetic. I don't know what I'd have to say to get her to investigate further if I were desperate. A lot of doctors just dismiss them out of hand. I've not had any embarrassment answers in psychiatry, but I did have a patient's dad who was adamant that his son wasn't psychotic. He was just lazy and didn't want to work. I mean, he thought he carried a demonic parasite that drained his soul, but yet. A relative of mine caused 2 other random patients to panic when she told them she had breast cancer. They thought it was highly contagious and were outraged about her being around kids. A patient with HIV verging on AIDS who did not want to take medications for it. Instead he insisted that an alkaline diet and antioxidants would cure him because germs can't live in the presence of oxygen. What antioxidants and alkalinity have to do with increasing the oxygen in his body I don't understand. Teenage male patient came into the clinic with his girlfriend because he was growing breasts with milk production. Turns out his girlfriend was giving him her female hormonal birth control pills for extra protection. Once had a patient ask for a fecal matter transplant, legit medical procedure, but they wanted cow fecal matter used. No, just no. They wanted cow fecal matter used. Bulls, plus 231 just for a one-word shit post. That was unexpected. I've gotten in debates with patients who have festering foot ulcers about the relative benefit of their dogs licking the wounds to keep them clean. I work in physical therapy and often get expert patients who don't want to trust my judgment as a clinician. They are so certain their doctor gave them instructions that are far from what is clinically safe or recommended. Then when presented with a kind but stern response, they want to make it seem like I haven't been licensed for many years and or maybe an expert in the area. At this point in my career I've seen hundreds of hip and knee replacements and even have spoken to most of the big name orthopedic surgeons in my area. I know what I'm doing and I know what these surgeons expect of me during my physical therapy. If we don't get the right outcomes they will not send patients to us. It's important that we know what we are doing to ensure job security. Had one last week that was giving my co-worker a hard time over their weight-bearing status, so I stepped in and told them that we have to follow the most recent doctor's orders regardless of any verbal orders a patient receives. If the doctor didn't transcribe an order, it's for all intents and purposes not valid. This patient was so sure of themselves, so I called the orthopedist on speaker to confirm the order. The orthopedist was very peeved that they were lying to us and scolded the patient. Apparently they had been pressuring the doctor for increased weight bearing to progress their walking, but the doctor had wanted to play it conservative and limit weight bearing for a few more days, weeks. It was pretty gratifying to watch their reaction and see them scolded for lying. TLDR. Patients can be pains in the asses and not trust your judgment and treatment. Patient was lying and was put on the spot during conference call with doctor, then scolded by doctor for lying. Not a doctor. I'm a doctor of pharmacy and sometimes it can confuse people that may think I'm a medical doctor. Anyway, this story happened a few weeks ago. Had OB nurse call me to talk to her family about vitamin K shots. These are given to newborns to prevent hemorrhages and excess bleeding. Now there is some controversy regarding the practice of giving Vitkin is kinda similar to the anti-vax movement. That's not why the parents were concerned. They read online the shot contains benzyl alcohol. Benzyl alcohol is not uncommon to have in some injections because it inhibits microbial growth to keep it sterile. It is very dangerous for newborns and is never in injections meant for them. The parents didn't know that part. They were upset because they thought that the alcohol is equivalent to giving the baby a full beer and will make it drunk. The parents were in their 40s. I have many more, but this is just one that is more recent. This one woman didn't understand why it was so hard to get rid of her cancer. She said, "Why can't you just find the one big cancer cell in my body and leave all the other ones?" I had a 63-year-old Asian woman come in with a lump on her breast. She said it had been there for 6 months, but she was treating it with Chinese medicine. She had me 2 weeks before the visit and that's why it's getting worse. I asked her to put on a gown thinking I am going to have to examine the breast to find the lump. The lump found me. 7x 9 centimeters. Black, red, inward nipple and raging eczema like pageants of the breast. Sent her to breast clinic urgently. My father was an oncologist, and one of his patients was a semi-known religious leader in our country. More of a cult than a religion. TBH. After a round of chemo, said patient threw up, and one of the members of their congregation told them that God had intervened and they had thrown up the cancer. My father tried explaining why this was nonsense, but they nevertheless stopped treatment and told their congregation that God had intervened and destroyed the cancer. Needless to say, they died soon after stopping treatment. I had a morbidly obese patient referred to me for back pain. His MRI showed mostly degenerative changes, and nothing yet surgical. I told him needed to lose weight. My regular doc told me the same thing. Really got on me for my drinking. 2. Said I can't be going out every night after work with my friends for beer, cause it was gonna kill my liver and keep me fat. Oh, so did you follow his advice? I asked. Yup, stopped drinking beer altogether. Now I bring me a 6-pack of that Ensure stuff when we go out. My buddies give me a hard time about it, but I told them I have to do it so I can lose some weight. Yeah, a 6-pack of Ensure every night is much better for your weight than a few cans of Bud Light Fasipum. The common ones are anti-vax nutters, especially those who want antibiotics for their spawn's obvious viral illness. Had a parent once tell me I should RX an antibiotic because their kid was unvaccinated. No. People who regularly use alcohol, tobacco, and drugs not wanting to be a pill taker or put unnatural things in their bodies. Opioid addicts who come up with every reason in the book why any pain medicine that is not an opioid is too dangerous to take. This is like saying you're going to swim across shark-infested waters because a well-constructed bridge to walk over them may collapse. However, possibly my most favorite one was this douche who came in because he thought he had appendicitis. Turns out he was actually right in that he did, and it had a microperforation and abscess already on CT because he'd sat on it a couple days. So Mr. Douche had googled it and decided that since in some places they treat appendicitis with antibiotics, he was going to do so for his appendicitis. I explained very patiently for way too fricking long that the research into that only applies to simple early non-abscessed appendicitis and was not appropriately applied to his situation. And I am bitter that I will never get that half hour of my life back. His main reason for wanting to avoid surgery? He didn't want scars on his six-pack. If you haven't already gotten the picture here, think of the situation from the Jersey Shore. I refused to participate in his stupidity and prescribe antibiotics, so he left against medical advice. Fast forward 2 days. He had purchased fish antibiotics and was taking that to treat his abscessed appendicitis. He now is septic with a fever of 103, a lactate of 6, and systolic BP in the 80s, which is hella sick. Fortunately for him, he was young healthy, and it's actually really hard to kill young healthy people. I'm not saying it's impossible, but you have to work really hard. So Mr. Douche pulls through but ends up with a full laparotomy, zipped right down the middle of his six-pack, instead of the nice little laparoscopy scars he'd have had if he'd come in the first day. It happened almost a year ago. I just finished my MBBS and I was interning at the same hospital I graduated from. As a part of our internship program, I was posted in a small clinic that deals with minor medical issues which don't require any major investigations. So one evening this guy walks in with a complaint of neck pain from morning of that day. After asking a few questions, it was clear that he slept in a weird position which was the cause of the pain. I tried to explain to him that the pain is temporary and there really is no need for him to take any medication. It was a govt clinic and we were running short of supplies. But the guy was adamant on getting a medication. So I prescribed a painkiller. And since this particular painkiller was known to cause gastritis, I also prescribed a drug called ranitidine, sold as a popular brand name called Rantac in India, as well. This guy knew that Rantac was something that doctors prescribed for stomach pain, and he had no idea what the other drug does. But once he saw that I have prescribed Rantac, he threw the prescription literally on the floor and started to complain to the nurse that my friend and I, didn't know anything and that we have prescribed a medicine for stomach pain when his complaint was neck pain. I turned to the nurse and just explained to her why I did what I did, and once he heard that, he silently took his prescription and walked away from there. 911 dispatch call that was transferred to M service. I need an ambulance. Okay, what's the problem? I think I have the flesh-eating bacteria. What makes you say that? Do you have any sores or anything? I went to sleep and woke up with holes in my underwear that weren't there last night. I'm honestly not sure how the EMT operator kept it together on that one. Not a doctor, but was discharging a patient and going through his instructions. I advised him to take his antibiotic with food. He asked, should I roll it up in a piece of bread? I told him he could try eating a sandwich instead. Not a doctor, but work in pharmacy. An old guy who had got an inhaler prescribed by his GP because he was allergic to his new dog. He came back to the pharmacy and said he was still completely breathless around the dog despite using the inhaler 4 times a day. On further question, it transpired that 4 times a day he was spraying the dog's coat with the Ventolin inhaler. Another gentleman who complained that he was in excruciating pain when inserting his suppositories and physically couldn't get them into his butt. Turned out he wasn't taking them out of the wrapper, which is normally made from really tough foil or plastic. Ouch. How did we ever survive as a species? When a woman in an emergency room told me she wasn't going into labor because her app said she wasn't ready yet, I could see the top of her daughter's head. But what the frick do I know? Keep asking Apple for advice. So I'm not a doctor, but a girl I went to high school with is in her 2nd year of med school and still posts anti-vax stuff for all to see. I know someone starting med school soon who believes mental illness is not real and people just need to suck it up. ED. I kept having diarrhea. Told my butt to stop it or I'd stop it my dang self. Now nothing is coming out. It worked. But my stomach hurts a ton now the past week. Got a plain film. Screwdriver in rectum. Handle first. He went to surgery. Once had a patient who took her baby to a chiropractor her friend had told her about. Her baby has a growth defect due to deficiency of growth hormone. She said her chiropractor would adjust it so baby will be happy again. It's comments like these that have made me come to a growing realization that hospitals and clinics might need to have CPS representatives in the building with the ability to suspend people's right to a child if they are putting them at serious medical risk. 60-some YO pancreatic cancer patient wanted to be treated with herbs and natural medicine instead of having the Whipple surgery she needed that could save her life. She let it progress while continuing to have it treated by her natural medicine doc. Finally came around after a few months. She's lucky she survived and went to the operating room. But immediately after surgery and through discharge from the hospital was trying to stay off the bowel regimen and other medications usually given after this type of surgery. Diabetic patient strictly adhered to her diabetic diet by drinking 12 cans of Mountain Dew the past week instead of the usual 24. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.